Hello friends, welcome to this health education event on COVID-19 organized by Coach Institute of Intercultural Studies, Hyderabad. As you are aware, here in India, we're in a terrific situation. In fact, it is a frightening situation and we are in a pathetic condition. And we are in a very critical days. Some of the predictions reveal that this situation is going to be more aggressive and terrific in the coming weeks in India, particularly in Telugu states. In these days, our known people are dying, and some of the friends, and in fact, some of our family members are affected by this COVID. My heart breaks when I see the news. The other day, I was watching 14 years old young boy was at the deathbed of his mother. The mother died with COVID-19, and even this boy has been diagnosed with the COVID. He had to be taken into isolation ward. There is nobody who could bury that mother. The municipal truck has come and took away the mother's body. The other day, the young boy fell on the street. I think it's somewhere in Guntur in Hyderabad, in Andhra Pradesh. He understood that he has a heavy COVID attack. Trying to reach an auto to get in, he collapsed on the street, died. There is nobody who could come and touch the body. Almost 3 hours the body was on the street. A few weeks ago, the boy cries to father in a WhatsApp video call saying, "Dad, I'm dying." Right here in Hyderabad. My heart is going down. I am dying. There is nobody who could help him to survive and sustain. The intensity of this COVID is very terrific. There is no medicine, by the way. Only we need to take care of ourselves with all the precautionary measures, and we need to see how best we can stimulate our immune system. And the only way that we can fight with this COVID is to taking care of our immune system, to strengthening our immune system. Here is an opportunity for all of us to listen to Dr. Bhanu, Prasad. He helps us to take care of our immune system with the vitamin D. Let me introduce Dr. Banu Prasad, who is going to talk to us this evening. Dr. Banu Prasad did his Doctor of Pharmacy at Triton University in New York, USA. He lives in New Hyde Park, New York. Fortunately, I stayed with him a couple of days in the year 2017. A common friend of us, Paul Chintapalli, introduced me to Dr. Bhanu. He came to airport and received me at New York. A busy man, a man who believes in integrity, honesty, and truthfulness, practices them in his daily life. A godly man who believes in God and works for God, by the way. And he did an amazing research on this vitamin D, and he has been enlightening around the world to take care of their immune system by giving sufficient vitamin D to the individuals. Today he is going to talk vitamin D benefits, deficiency, dosage, and toxicity. If you have any doubts, you can ask him after the talk. He will be taking about 45 to 1 hour lecture, and then we will have sufficient time to ask questions. He's a wonderful man. Let's listen to him. We are fortunate to have him this evening. Dr. Bhanu, we are so fortunate to have you. Thank you very much for taking time and being with us virtually this evening. Let me pray for you before you take over the session, and then we give time to you. Let me pray for you. Lord Jesus, I pray that your presence be with us. Thank you for Dr. Banu, who is with us this evening. Lord, you bless him. Fill him with your words to communicate in a way that we can understand the importance of this vitamin D to improve our immune system. And also we have a lot of questions. Help us to get clarity to our questions through his talk. Thank you for these of my friends who are watching on Facebook and who join on this Zoom virtual class. I thank you and I praise you for our institute, Coach Institute of Intercultural Studies. Thank you for the organizers. Bless all of us with all the authority that I received from heaven. In the name of the Father, Son, and the Holy Spirit, I rebuke all the distractions that are there. I pray that we all may have undivided attention to listen to the teaching coming from Dr. Banu. I commit this time into the mighty hand of our Lord Jesus Christ. Amen. Amen. Yes, Dr. Banu, this is time for you. Take your own time and then we ask questions.
The countries and communities alike, and so much so that we don't have a viable solution to go forward, even 6 months or 7 months into this crisis, since they started in China about 7-8 months ago. And since that time, there have been several the thought patterns and that dominated the societies. And initially we thought this is a pandemic that is confined to a specific geographical area and a specific country. And soon all those concerns and all those understandings, all those conceptions or misconceptions have been proven wrong. And so much so that many experts, what they say today is not what they say tomorrow. And as more and more details that we learn about this disease and this pandemic, more scary things are being revealed, and which is sending shockwaves through medical communities and political communities, and also the entire countries, entire nations. And I'd like to start with a verse in the Bible. It says in Proverbs 22:3, it says, the prudent see the danger and they take refuge, but the simple keep going and pay the penalty. And it is such a wonderful verse, which clearly addresses the current situation at hand. And where are we in India? About 8 months ago or 9 months ago, when everything started in China, and it has been making its rounds. This virus has been making its rounds in China and later on in Europe, like Italy, Spain, and later it came to the U.S. And first cases were identified in January, late January, and you know exactly how much of a destruction this has elicited on these societies, where in few moments and few weeks, thousands of people have succumbed to this disease, where this disease progression has been so quick and so fast. And in India, at that time, we implemented the lockdowns, and the idea of the lockdowns is a very good one, because when there is something that is not understood, and we don't have a proper understanding of such a disease, yes, lockdowns are necessary, because we want to limit the number of people who get exposed to this unknown or the poorly understood disease, so that we can limit the damage that can result in because of the overwhelming of patients coming into the healthcare system. So the goal of lockdowns, and so the initial measures that were taken, like social distancing or wearing face masks or social isolation, all these things are intended to curtail the spread so that our healthcare systems are not overwhelmed. Yes, that did serve its purpose, but where are we now? The thing is, that entails, that lockdowns and initial measures, they entail finding of a solution so that we can effectively address this pandemic. And most of the experts initially, they went on the televisions and told people that this is okay, we can deal with this disease, we can just a little fever, this and that, and you can take crocin and stay home. And as the lockdowns were lifted, see, initially when the lockdowns were in force, most of the people who were affected by this are the people who were outside. And the people who are outside did not get affected as much. And that indeed gave rise to some kind of false sense of security that, we have successfully beat this, because the mortality rate in India is extremely low. It is only 2 per million people. So 2 persons dying per million, and that is far better than any other country. And in Belgium there are 800 plus people died per million people. And so while comparing those to the countries that have been affected the most, and we started feeling a little bit of ease. And then what we started doing is lifting down the lockdowns. And when the lockdowns were lifted, we know exactly what happened. The people who were confined hitherto were exposed to this virus, and they started getting more. In late May, people started noticing more and more infections. So, and people started taking the advice of these experts who were inside, and who told them, stay inside and take crocin, and you can manage this disease successfully. Yes, the first 10 days of the disease was being managed successfully, and that is, that was true. But the problem is, this crocin or the paracetamol or whatever, while they were bringing down the fever and being able, they're able to address the pain or the body pains very well. And people went in, they went into this false sense of security. They were lulled into false sense of security. On the 10th day or 11th day, people started noticing something very disastrous and very dangerous, because they're not able to breathe. What is happening? What is, people are waking up to a new reality now. Okay, and all the experts who said that you can beat this disease by staying home and take crocin, they're not coming on the televisions anymore recommending the same thing, because that message has been so widely propagated, and everybody started taking crocin and containing the temperature and being oblivious to the eventual damage that is coming. And brothers and sisters, that is exactly where we are right now in the society. And that is when we are seeing these people showing up into the emergency rooms and the doctor's offices with completely compromised lungs, and they are not able to breathe. So this disease is a very serious disease. We all need to pay attention to to the seriousness of this. If we do not address this properly, we pay a serious price, and that is exactly where we are. And while the death rate was 2 per million, now it is approaching 24 per million, and it is on the rise. So that is where we are in the current scenario in Indian society. Okay, how do we understand this, the behavior of this COVID spread? See, initially they said, okay, symptomatic and asymptomatic spread. People did not have any symptoms initially. Most of the people who did not have any symptoms have been going around, and they have been spreading the disease. And also, even now, people who contracted the disease and still managing their symptoms well with paracetamol and other agents, and they really think, and they were in denial. They are in denial that they did not have this disease, because this is very unknown and extremely scary. And people, it is common human nature to think we did not get this disease. But the thing is, reality will not wait, and that is where we are. Symptomatic and asymptomatic spread. Yes, it can be, this disease, I believe, can be spread even when patient is symptomatic and when the patient is asymptomatic also. One feature about this disease that is very different from the previous diseases is this virus. There is a viral replication potential in this disease is 1,000 to 10,000 times higher than the previous coronavirus diseases. So when the virus is replicating that fast, body does not have enough time to respond. And once around the 10th day or 11th day, the whole lung system, lungs are compromised and they are completely inundated with virus. That is when the immune system wakes up. And if the immune system does not function properly, what happens is the immune system is equipped with chemicals called cytokines. These cytokines are extremely corrosive substances whose intent it is to fight the pathogen. So what is happening is because the immune system is such a wonderfully designed system, and it has to be regulated properly, it has to be controlled properly so that these toxic substances are used wisely against the pathogen, not against our own organism. So when there is a dysfunctional immune system, it is in question. What happens is these cytokines are unregulated and they are generated in massive amounts, and there is a cascade of these cytokines being released, and it is like pouring acid onto the lungs. And that is the reason why the lungs are getting destroyed in such a short order. Within, we have seen people without any symptoms, and going from there, on their way to the hospital, they succumbed, they died, not able to breathe or not able to oxygenate their blood. Such is the seriousness of this. And also there is and there have been a lot of um, you know there is a lot of confusion in testing also. Some people are getting tested negative, but still on the 10th day or 11th day they are developing this symptoms like COVID symptoms, and then they are being tested positive. So we cannot completely rely on the tests also, and that is adding to this confusion. Some are getting tested positive and some are getting tested negative. Even the people who are getting tested negative are showing symptoms of pneumonia, this bilateral pneumonia and ground glass opacities, and the doctors are treating them for something other than the COVID infection, what it really is. Okay? And we have seen so many people who are getting treated for typhoid and various other diseases. And only when it was too late, people are getting admitted to the hospital where the 80 to 90% of the lung tissue is completely compromised, necessitating the use of ventilators and oxygen supplementation. So, so what are the benefits of vitamin D? See, the thing is, I just said just a moment ago that immune system has to function within the direction and a proper regulation, and that is called modulation. So immune system, when the immune system is modulated properly, the immune system rises to the challenges that is posed by various viruses and various bacterial illnesses. And this is if immune system is not regulated, it results in a condition called cytokine storm. That is, the cytokines being generated and getting in, they are inundating the tissues of the body and completely destroying these things. So vitamin D is instrumental in modulating the immune system. That is very clear from the recent scientific research of the past 20, 30 years. And vitamin D's role in properly modulating the immune system and addressing the autoimmune disorders is very, very, very well known. And now, brothers, this can be understood as an severe autoimmune response, because body is not able to, these responses that it is generating in response to this viral proliferation, what is happening is those responses end up damaging our own body. So this can be understood as severe and a rapid autoimmune disease. And if that is the case, if that be the case, autoimmune diseases have been successfully treated by administration of heavy doses of vitamin D3, because the sad situation in India is 80 to 90% of the people are vitamin D deficient, because as a society, we have completely ignored this vital nutrient. And that is the reason why we are in this situation. And there are countries, we can look at the epidemiological studies of the countries. And we look at China, there are thousands of deaths. You look at Russia, there are thousands of deaths. There is a little country which sits between those two countries called Mongolia. And that Mongolia does not have any fatalities whatsoever so far. Why? Why is that? 2 years ago, or 2 year and a half or 2 years ago, Mongolia as a whole concentrated on people's vitamin D deficiency, where 90% of the people were vitamin D deficient in Mongolia. And one of my friends, Dr. Leslie Ray Matthews, went to that country, and he was on the national television urging people and showing people how to correct their deficiencies. And Dr. Leslie Ray Matthews is a trauma surgeon in Atlanta, Georgia, and who has been successfully using vitamin D3 in trauma patients for the past 15 plus years, very successfully, so much so that extreme trauma care patients in his practice, the mortality rate is only 3%, the industry standard, while it is 10 to 12%. So the vitamin D's role in is extends far beyond our immune system, but it extends beyond our even in the trauma cases, people who received vitamin D in high doses have responded extremely well. And it is if you take the neurological system, if you take the reproductive system, our endocrine system, vitamin D's role, we cannot neglect it, or we cannot overlook it. So it is such an important vitamin. Why did we end up where we are now in the whole population being vitamin D deficient? That is because there are three reasons for that. One is, first of all, we completely forgotten that we assumed that India has a lot of sun and we will have enough vitamin D levels. That assumption is false, because vitamin D generation in our skin, it depends upon a lot of other factors, like us having proper cholesterol levels. When that cholesterol is exposed to the ultraviolet B rays, that is when the ultraviolet B rays are plentiful in the sun from 10 o'clock, 10 in the morning to 3 in the afternoon, and nobody goes out during that time. That is one thing. And I want to say, make a note about, say, 50, 60 years ago, in the agrarian society that we are, when people were going into the sun and working and eating properly, their vitamin D levels, according to some studies, were in the 80 nanograms per ml, which is sufficient, which is very, very, very good levels. Now everybody's levels are in the single digits. Almost everyone that I encountered, single digits are in teens. So that is a very dangerous situation. The first reason is that assumption that when we go into the sun, the vitamin D is automatically generated. That is a false assumption. Okay, we have to take a very closer look at that. The second thing is, for the past 60 plus years, the humanity has been fighting a war against cholesterol. And we thought the cholesterol was the reason for heart disease, and we have been treating it as such. And this cholesterol levels being controlled by all these agents, and we are still looking at alarming increase in heart disease. I think as a society we need to take a very closer look at that. See, all these assumptions that are deeply affecting our health. I think public policy makers have to look at these things. And the third reason why we are vitamin D deficient is our agricultural production is completely concentrated with is a lot of chemicals. So, and we use a lot of organophosphates and organophosphonates in our food production, and so much it is entering into our food supply. And when we consume these organophosphates and organophosphonates, there is a clear mechanism by which it suppresses or it compromises the cholesterol transport mechanisms in the body. When the cholesterol transport mechanism is compromised, proper levels of cholesterol do not reach to the skin, where they can be exposed to the sun and the vitamin D can be made. So there are three reasons that those three reasons I observed are responsible for vitamin D deficiency in our country, or for that matter, in the world. So how do we do that? And also, how do we correct it? How do we correct this vitamin D deficiency? The traditional understanding of correction of vitamin D deficiency is taking one capsule or one pill of 60,000 units once a week, for 4 or 5 weeks or 6 or 7 weeks, and in such durations. Even here in the US, there is 50,000 unit vitamin D that is available, and that is also used once a week, or in some severe deficiencies 2 or 3 times a week also. And what we notice is after years of supplementation at that level, people's vitamin D levels are barely touching the sufficiency. And even some people who are taking at 50,000 units a week or 100,000 units a week, their levels do not come up that easily, because vitamin D consumption in inflammatory states, body uses up the vitamin D to fight inflammation and fight various stresses. And some people's vitamin D level requirements are a lot higher than other people. So we cannot just simply assume that one pill a week is going to correct our vitamin D deficiency at all. And also, how did I reach this protocol where this has been so effective in so many people? Okay? Here, when March rolled around, and all our employees, from February, we've been supplementing with 20,000 units of vitamin D daily. We did it for 8 weeks, and their levels came up to 80 to 100 nanograms per ml, so which is a protective level. And we have, even though we are experiencing this outbreak all around us, New York has been the hotspot. And when we are experiencing this outbreak all around us, all of our employees have been protected, and their families also have been protected. That, and emboldened with that, and I went ahead and calculated the total dose that we have given to them, because we were seeing some patients are getting stricken with this coronavirus cases with a lot of symptoms. So I compressed that dose, that 1 million units, that 10 lakh unit dose, into 5 days. And we started, and me and a group of other doctors started giving that dose to COVID patients. And we saw excellent results. Like on first day, the cough goes away. On the second day, the fever goes away. By third or fourth or fifth day, most of the symptoms are completely resolved. And people have been tested negative even on the ninth day. And so almost all the people that we have tried that in, they've survived. And since that time, I've been sounding the alarm with my Facebook posts and various other means in India, and that message has not been received well. And doctors say, that is toxic, that is we cannot take more than once a week. That is not true at all. If you look at how vitamin D works in our body, and the toxicity of vitamin D is extremely rare. And when talking about toxicity, we have to address two different forms of vitamin D that are available. Okay, one is vitamin D2, which is not the natural one, which is from the plant sources. And the second is vitamin D3, which is from the animal sources, and also which is made from the wool grease. That is, when they shear the lambs, they boil the wool, and when the fat that comes out of that is pure cholesterol, and that is exposed to the ultraviolet rays, and that is how vitamin D3 is made. So that vitamin D3 is the natural vitamin D3, which is utilized by the body extremely well, and which does not lead to toxicity at all. And all the articles which talk about toxicity, they conflate these two formulations, and they do not make distinction. And if you dig into the details, and it is the vitamin D2 that they're talking, which can be toxic in a month, even after a month. But vitamin D3 is definitely not toxic, even in higher doses. Like, even if people take 100,000 units, that is 1 lakh units daily for 3 to 6 months, it has not resulted in any toxicity. That is how a Mayo Clinic paper concludes. So, and is it the toxicity? And when I suggest this, people go onto the internet and take a look at all the toxicity or the symptoms on Google, and they say they're afraid. It causes kidney problems, or heart problems, or this problems, that problems, and which do not happen. Even if they do not happen for 6 months or more. And we are not suggesting, or nobody is suggesting, you take this levels of vitamin D at that long. And what we are suggesting is you correct your vitamin D levels aggressively, because this is in the community spread. There is no way we are going to escape the exposure to this at all. So that is the reason why we are suggesting aggressive correction is required, because we cannot risk a cytokine storm destroying our lungs. Once the lungs are destroyed, it is a matter of hours or a matter of minutes. People succumb to this, because if we cannot take air in, it is impossible to survive. So, and also even in India, recently on Rakshana TV, one interview came, And that interview, I presented all these details, and many people have benefited, and a lot of people are using it. A lot of even doctors are using this in their practice with excellent results. So we do, brothers and sisters, we do not need to fear. God has given us a way out of this pandemic, and what we need to do is we need to pay attention to our nutrition and if we expect our bodies to function the way God designed us, we need to provide it the nutrients that it needs. So vitamin D is one such thing. I'm not just saying if with one vitamin D we are going to fix all the problems. No, I'm not saying that at all. But we need to pay attention to our nutrition, how we are eating, how we are taking care of these bodies that God has given us, and providing them proper nutrients and also proper and protecting it from exposure to chemicals and toxins that are all around us. And also in India, one more thing that I noticed is there is a lot of diabetes incidents. Okay? The diabetes, every other person that I see in India is a diabetic, and even the COVID patients. It can be a very difficult condition to deal with in COVID patients, because if you keep on eating the carbohydrates while being infected with COVID, that can trigger other pathways which can generate the like IL-17 pathway. So there are several cytokines which can be triggered in that pathway, which are not beneficial, which can add to this crisis. So controlling the sugar numbers, our diabetes numbers are extremely important. That is, I'm not just taking insulin or not just taking medicine so we can continually eat. What we need to do is we need to control or completely stay away from carbohydrates. In that context, your best bets are eggs and also the ghee. Okay? If you take your food with a lot of ghee, that does not generate a lot of insulin response, and those are your best bets. And also ghee and all those things will work extremely well by stabilizing the tissues that this pandemic affects. So how do we take vitamin D? Okay, and if somebody is presumptively, if anybody is deficient, okay, that means I would like to present one statistics from one study that has been recently done. In that study, they have noticed people with vitamin D deficiency. See, the deficiency is defined as 20 nanograms per ml of vitamin D are lower in the serum, in the blood. Okay? And 20 nanograms per ml are lower, and insufficiency is 20 to 30 nanograms per ml, and sufficiency is 30 nanograms to 100 nanograms per ml. So deficiency is 20 nanograms or below, and 20 to 30 grams is insufficiency, 30 or above is sufficiency. So in sufficient group, the mortality rate is 4%. So 4 out of 10 COVID patients who have sufficient levels of vitamin D have died. That is 4%. So 96% survived. Then in the insufficiency group, 20 to 30 nanograms per ml group, 88% mortality rate. So only 12 people in this group survived. That is a lot of mortality. That is from 4% death rate to 88% death rates. 4 people out of 100 to 88 people out of 100 in the insufficiency group. Now we get to the deficiency group. In the deficiency group, the mortality was even higher, 98.9%. So 99 out of 100 people who are deficient, who got exposed to COVID, they died. Alarming, isn't it? It is such a serious deficiency that we're dealing with. So in that context, how do we fix this deficiency quickly? And we can, it is available in 60,000 units capsules in India. All adults and can take one capsule starting now, one capsule 2 times a day for next 5 days. So that will be 2 capsules, that is 120,000 units of vitamin D3. next 5 days, that is 6 lakh units over 5 days, and then take another one capsule daily for 5 more days. So that will be total 15 capsules, that is total 9 lakh units in 10 days. I do not have any doubt in my mind that your levels will come up to a protective range. Okay, at that point, you will stand a fair chance of surviving this disease. Okay, that is what we have observed here, and that is what we are observing in India. And after that, thereafter, you can take one capsule every week, okay, and for 6 weeks, and then get tested for vitamin D levels. Okay, so you get tested, and then you see where you are. And my preference is you need to maintain it around 100 nanograms per ml. Okay, and vitamin D is not toxic in single doses or even high doses, because vitamin D is given in 6 lakh units to autoimmune patients at once. And also there are 33 clinical trials going on all around the world using high dose vitamin D3 in COVID patients. So that ought to tell us something. Okay. We need to put aside all these the old understandings of vitamin D and how it is affecting us, because the world has moved and the world has come to a place where our vitamin D requirement has gone up exponentially, and we have not, our recommendations have not changed. And that is simply the sad truth of where we are right now. So and also there are questions about how people with chronic diseases like blood pressure or diabetes or other diseases can take this. Okay, and in every disease that we look at, the thyroid disease or blood pressure or diabetes, the common feature is vitamin D deficiency. Okay, so vitamin D is crucial in controlling, in modulating not only the immune system, it modulates the gene expression. So if these rare autoimmune disorders respond extremely well to vitamin D supplementation because of that, because when genes are not properly controlled, and they can some genes can express and make compounds that are implicated in autoimmune disorders like rheumatoid arthritis. One of such things is TNF alpha, and TNF alpha is implicated in rheumatoid arthritis. And when vitamin D is given and TNF alpha levels go down, that is the basis. That is the basis behind giving high dose 6 lakh units injection in patients with rheumatoid arthritis. So we do not need to fear taking this vital nutrient at all. And also we have seen, I think Dr. Potana can tell you, and he has been experiencing this cytokine storm, and he's breathless, and though he was not tested, but the thing is, these tests are not conclusive, and what we can do is we can get his antibody levels taken, and then we can conclusively prove that he was indeed has been dealing with COVID kind of infection, because that breathlessness is a prominent feature of this disease. So I'd like to conclude by saying this vitamin D deficiency is, I clearly explained it to you. And also in COVID positive patients, I'd like to end by this, saying in COVID positive patients, we should not fear giving them higher doses, not more than two capsules, even 6 or 7 capsules if required, to control the symptoms. If somebody is in a severe cytokine storm, vitamin D is the only thing that can absolutely address the cytokine storm, and that is what we have noticed here. And also it can stabilize the respiratory epithelium, and it can stabilize the lung tissue, it can stabilize the blood vessels by stabilizing the endothelium of the blood vessels. And there are so many things. And also another thing that it does is it downregulates something called renin angiotensin system, which goes out of whack, where people's heart rate cannot be controlled, and when it is driven into overdrive, that is a result of this viral proliferation that has been going on in the body. So let us take heed to this message, and as the Bible says, the prudent see the danger and take refuge, but the simple keep going and pay the penalty. If you are a doctor, please look at all the research, because this is a very fast moving infection. We do not have time to deal with it. We need to deal with it. We have to have a real solution. unless we have a real solution. All these things that we have been doing, lockdowns, our social distancing measures, they are not sufficient to get us out of this mess. So let us improve our nutritional status. Let us improve our vitamin D status. Let us fearlessly, let us confidently approach this. And I'm not saying we should go out and get exposed because we have this solution. No, let us be responsible, because we have this because we have this knowledge now, and we can be a little more confident. We need not fear, as long as we can bring up our vitamin D levels in a quick manner. Okay, thank you so much for your time. And if you have any questions, we can address that at this time.
Thank you very much, Dr. Bhanu. You made it very, very clear. You explained the theory and you gave us a solution how to address this. What I request the friends in the group, if you have a question, raise your hand. I'll allow one by one to unmute so that you can ask your question. Anil here, you can ask Anil.
Doctor, thank you so much. Just you told me vitamin D3 and D is both are different or both are same?
Vitamin D and vitamin D3 are the same, and vitamin D comes in two forms, and which is the fortunately and luckily that the other form, which is not beneficial, is not available in India. Vitamin D2 is not available in India. So what is available in India is cholecalciferol, and cholecalciferol is vitamin D3.
Yes, Ketan.
Yeah, praise the Lord, brother. Just tell me how much dose we have to take, and then afterwards also prescribe us some, trade name so we can buy accordingly. Considering Indian this one scenario, because which medicine are available in India, I really don't know. So accordingly, dose, and then afterwards, how much dose we should take per day for how many days, and then afterwards, trade the name of the dose. So I'll just note it down.
Okay, brother, what we can do is this. Okay, you see, right now we don't need to worry about what manufacturer it is, because as long as it is cholecalciferol, you can even take the generic things that are available there, which are extremely inexpensive, and you can procure whatever vitamin D3 you can get there. So the second thing is the dosing schedule. The suggested dosing schedule, I'm going to send it to Dr. Potana. He can post it to the group later on. I have by age wise, I did it for correction, for prophylaxis, and for when somebody is infected, what to do. So I have written it up. I'll send it to Dr. Potana.
Yeah, Brother Murali Krishna.
ప్రైజ్ లార్డ్ బ్రదర్. మా బ్రదర్ ఇన్ లాకి పాజిటివ్ వచ్చింది, కాకపోతే ఆయనకి ఇంట్లోనే ఉంటున్నారు, ఎటువంటి సిమ్టమ్స్ కూడా లేవండి. టెస్టింగ్ చేసి మొన్న శనివారం నాడు చేస్తే మంగళవారం నాడు పాజిటివ్ అని ఇచ్చారు. సో ఆయన ఎలాంటి వైటమిన్ D3 తీసుకోవచ్చండి?
Okay, so what we can do is this. Okay, how long ago was he? So it's 4 days since he's been diagnosed, right?
అవునండి.
Okay, what symptoms does he have, brother?
He does not have any symptom as of now.
Okay, so in that case, we should not wait till the 10th day where the real cytokine storm happens. Your brother-in-law, or the person that you're referring to, is a typical case of asymptomatic person. Okay, even in asymptomatic persons, the cytokine storm can happen, and quickly he needs to be supplemented with at least one. Since he does not have any symptoms, I would do 1 capsule of 60,000 units 3 times a day for 5 days. Okay, so then that will, in 5 days, it will bring his levels up to a point where it is protective, and after that take 1 capsule daily for 10 days, so he will be safely out of that the cytokine storm, the duration.
Okay, thank you, sir. Thank you.
And also one more thing that I want to address is this. While your vitamin D levels are getting normalized, your water requirement goes up quite a bit, because all your biochemical processes and enzymatic processes are being kick-started. So your water requirement will go up, and start taking 1 glass of water at least every 30 to 40 minutes, because it is that important. You need to do not guzzle it down, because if you guzzle it down, the water passes through your body very quickly, and sip it slowly. So every part of your every body can be hydrated properly. So water is extremely important. And the second thing is the diet. Okay, when somebody is COVID positive, intermittent fasting, look it up, because intermittent fasting or fasting mimicking diet, the basis of which is to control the glycemic response, glucose response, and the insulin response. So do intermittent fasting. Take your breakfast late, around 10 a.m. and dinner early at 5 p.m. and all with lots and lots of ghee, okay, and eggs, and very low to no carbohydrates at all. So that I wanted to say that and I forgot. Okay, go ahead, brother.
Okay, Joe, JSM, brother, can you talk? You have a question, or else Naveen?
Yes, brother. Brother, good evening.
Good evening.
Yes, brother. I have few doubts. Koni doubts unnai.
Sure.
Please, brother, bear with me. One thing is, my mother went through some lungs infection, and she was given steroids. Steroids తో తాను ఉన్నారు కొన్నాళ్ళు. ఇప్పుడు స్టెరాయిడ్స్ లాస్ట్ నవంబర్ ఫిబ్రవరిలో స్టాప్ చేసిన తర్వాత మామూలుగా తనకి సపోర్టింగ్ ఇచ్చారు. క్వశ్చన్ ఏంటంటే ఇప్పుడు తను యూజ్ చేయొచ్చా అని. D3 డేకి మీరు చెప్పినట్లు మార్నింగ్ ఒకటి, నైట్ ఒకటి, డైలీ 2 ఆ టైప్ లో మనం యూజ్ చేయడం వల్ల, ఇక్కడున్న మాకు డాక్టర్ MD ఏమన్నారంటే అలా యూజ్ చేయకూడదు, వీక్లీ వన్సే చాలా ఎక్కువ అని చెప్పారు. సో ఆ ఫియర్ వల్ల మేము ఒకటేసి ఆఫ్ చేసాము, ఈ రోజే స్టార్ట్ చేసాము. సో
అది తప్పండి. ఎండి గారిని ఒకసారి నా మెటీరియల్, నా వీడియోస్ ఒకసారి చూపించి నేను మాట్లాడమంటే ఆయనతో మాట్లాడతాను. కానీ that we cannot do that, because this is such an extremely important thing right now. Okay, we cannot just stop at once a week. If you take once a week to correct the deficiency, it may take 1+ years. Okay, and that recommendation by all these clinicians should have been given 2 years ago.
okay.
So if you did that for 2 years, maybe yes, your levels would have come up. Okay, this toxicity, as I mentioned, is not going to happen for the next 6 months if you take at that level. We are not recommending that, and we don't want to, and we shouldn't. After, see, for the first 5 days or first 10 days, in the prophylaxis for 10 days, or in a case of infection, 5 days, in the higher doses is not going to be harmful at all. In fact, most of the respiratory illnesses respond extremely well to vitamin D normalization. So you need to, doctors need to look at that research instead of going by the old, outdated recommendations about vitamin D supplementation. And according to some studies, 40,000 units taken daily for 2 years has not resulted in toxicity. That ought to tell us something. So please, you do because it is your health, it is your life we are dealing with. So in this crucial time, let's not be constrained by old recommendations and old research which is almost 40 years plus outdated. Okay, and let's continue. Let us take a look at, with an open mind, let's take a look at how important this vitamin D is. See, thing is, if it is that easy to correct vitamin D, okay, why is 80% of the people, 90% of the people deficient? Okay, these clinicians who are telling you, they should answer that question first. It just burns me up. While people are going to their deaths in 10 days, these clinicians are concerned about some consequences that may happen in a few people 6 months from now. And this is what I've had to deal with for the past six months. Okay, instead of while saving people, while giving it to people, seeing them recover so well. Okay, vitamin D is not toxic in single doses, and vitamin D is toxic if you drive these levels to 300, 400, 500 nanograms per ml and let it stay there for months together. That is when it is toxic. It is impossible to drive it to that levels with these doses. Okay, and also do not think that your vitamin D level, if you push it to 100 or 200 nanograms, it is going to stay there forever. No, it's not going to. Okay, we have our patients, we had to drive those levels up to almost 200 here because of certain conditions they have. and they were not responding. So in 2 or 3 weeks, 4 weeks, they responded, and their level went to 190. 4 weeks later, their level from 190 came down to 72, and in some people it came down to 63. So please do not think that vitamin D levels are going to be toxic and they are going to stay there. Once you drive it up, it's going to stay there forever. This understanding needs to change in clinicians and the general public.
Yes, brothers. If you really, any one of you have some trouble with the doctor, I will. Dr. Bhanu can talk to your doctors. You just text me. I'll connect you with Dr. Bhanu. He will talk to your doctor. Next, Naveen, can you talk? Naveen Shura.
Hello, brother. Praise the Lord. This is Naveen here from Pune. I had one question. I have a son who is 14 months and a daughter who is 5 years old, and a son who is again 14 years old. So what is the dosage that I should follow for them, especially for the 5-year-old and 14-month-old?
So, brother, I'm going to post that chart to Dr. Pothana. You know what? Let me check. If I have it here, I will post it in the discussion right now.
Yeah, you can directly post in the group. Otherwise, I'll send it to every one of you.
Okay, go ahead, brother. Go ahead with the next question.
Do you have any question?
Anna.
Yeah.
Brother, good evening. This is Chakri, and I have 3 questions here. Number 1 is, the person who is not affected by the COVID-19 virus, can he use these vitamin D4 or D3?
Yes,
number 2 is,
yes.
So,
Go ahead.
Can we, Anna?
Go ahead. Yeah, go ahead. Go ahead.
Can we use it, Anna?
Yes, of course, because vitamin D levels are important whether you have COVID or not. And that is the reason why you need to presumptively and prophylactically correct the deficiency as soon as possible. Once you do that, it's you're going to see a lot of wonderful changes that are happening in your body. The way your hormones are regulated will change, and you will notice that that difference in a month or so.
Yeah, and another one is, I have some kind of breathing problems often, but not regularly. When I go for the jogging like that, it becomes normal. Can you give any kind of solution for that? And another one is my mother, was suffered from some kind of liver failure in the past, and now she is in my village. Can she use this kind of vitamin D4 or D3 to protect from COVID-19?
Yes, it is yes on all counts, brother. Your respiratory illness can respond to vitamin D correction. I think you may be deficient in vitamin D. Please check your levels, okay? And you will definitely benefit from correcting vitamin D levels and bringing them up to about 100 nanograms per ml. Even in your mother, okay, the liver condition, yes, vitamin D is converted in the liver. If there is any liver disorder and all those things, see, what we can do is we have proper testing now. Unlike 50, 60 years ago, we do have a test. We can test these levels very easily. These tests are accessible, so there is no possibility of anybody becoming toxic on this. Because we are recommending every 2 months, or initially until you figure out your dosing. Because, and as I told you, vitamin D is used up differently in different people. Okay? So until you figure it out, okay, get tested, every 2 months. And once that happens, then you can come to a proper supplementation regimen, even for your mom and for yourself also. And brother, this chart is disabled, so I am not able to post anything here.
Okay, 1 second. Yeah, I enable it now.
Okay, let me.
Yeah, we got it. Friends, you can save that, copy and paste in somewhere. Otherwise, it will disappear when we shut down this. Even if you are not able to copy, don't worry. You text me, I will send it. Okay. I'm not sure how much time Dr. Bhanu has. He's a very busy man. Right now, he is in his work. Grateful to him for sparing this time. Let's ask quick questions. If it is very much essential, you ask. Some of the questions have been already cleared in his theory and explanation. Brother Somashekar, can you?
Yes, brother. This is Somashekar from Kolkata. From yesterday, I'm having mild fever, and there is no breathing problem as such. But we are worried that here in Kolkata, the COVID is so much spreading.
Brother, see, the thing is, you are very, correct to be worried, because breathing problems do not show up on day one. So, say, as I told you before, okay. With this, the breathing problems show up when this virus is proliferating uncontrollably in your lung tissue. That is when your immune system gets into action. That is when, if your vitamin D levels are not proper, that is when these breathing problems can happen. If you wait for breathing problems to occur, it is too late. Do not wait for it. Okay, it doesn't matter whether it is COVID, non-COVID. We cannot wait, and we cannot take that chance right now. Okay, start with the COVID dosing right away. Yeah, 1 capsule 3 times a day. Okay, or if needed, increase it to 4 times a day. Okay, there is nothing wrong with that. We have given it to almost 10 doses a day. To control the symptoms. So please do not worry about it. And what we need to fear is the 10 days from now. Okay? So 10 days from the time your symptoms started, that is when the lung tissue is affected. So use it now, and to protect your lung tissue. It doesn't matter. We don't need to wait for symptoms to show up. Correct your levels now.
Yes, brother. One more question, that my father-in-law has 2 brain strokes, but we want to also give vitamin D3 for him. What kind
Absolutely,
of
and absolutely positively, because these strokes, brain strokes, is it a hemorrhagic stroke or ischemic stroke?
Ischemic.
If it is, whatever it is, okay, it is resulting in destabilized endothelial tissue, the blood vessels becoming weak because the endothelium is weak. So vitamin D's role in protecting the endothelium or stabilizing the endothelium very quickly is very well documented. So everybody would benefit. You know what? Brain strokes or what strokes, whatever. If you take proper fats like ghee and take vitamin D and normalize the vitamin D levels, I think it is only better for them. And also vitamin D reduces the inflammation like no other agent. You can see that. Okay, within a day or two, you can see the CRP levels dropping through the floor, and the D dimers dropping through the floor, and even the inflammatory cytokines like IL-6 dropping. We can notice by right after supplementing with D3. So absolutely, brother, with strokes and heart diseases, and if anybody has stents, it can. The processes that result in revision of the stents is inflammatory process. This addresses inflammation like no other agent.
Yeah, Brother Vikram, can you ask a question, please?
Thank you, Venkat. Good evening, sir.
Good evening.
The thing is, I am a diabetic patient for the last 10 years. Can I use the same dosage which you have suggested? I am 62 plus age.
Yes, sir. Yes, absolutely. A resounding yes. Okay, and also maintain. Take a look at your diabetes levels, because diabetes levels can positively respond to vitamin D supplementation and vitamin D correction. So monitor your blood sugar levels before taking the medication while taking this.
Okay, thank you. I mean, if it is higher, I should not use it.
Which will? Oh, no. If it is higher, no, you should not eat. That's what I'm saying. You need to control your blood sugar levels properly. And also, even if it is higher or lower, vitamin D is essential. Vitamin D is non-negotiable.
Okay. Thank you very much.
Yeah, here is a Galaxy A718. Can you ask a question, please? Yes,
Hello, praise the Lord, brother.
Yes, praise Lord.
Thank you so much for explaining the necessity of D3 in these pandemic days. Really, as a oasis in the desert, God raised you in these pandemic
Thank you.
days.
Praise
Thank
God.
you so much, brother. I have one question. Can we take directly D3 capsule or along with some coconut oil or ghee? Some are telling that if you won't take ghee, it won't work like that. Some are telling.
No, see, we have seen it work even without ghee. But thing is, if you take with, taking it with coconut oil or ghee is a very good recommendation, because since this is a fat-soluble vitamin, the absorption will be better and the availability will be better. So you will get benefit quicker.
Okay, thank you, brother. One more question. One is complaining that chills are coming taking by D3. Is it right or not?
You know what? They may be dehydrated. So what I have said before is, if that can be a good thing. Chills and all these changes that are happening, if they are extremely deficient for a long time, chronically deficient, and vitamin D correction can make other changes in the body, and producing chills or this heat, some sensation of heat and other things, that can be managed very well by properly hydrating and properly managing the blood sugar levels.
Okay, brother. Thank you so much.
Yes, Brother Pradeep. Yes, Brother Pradeep.
Praise the Lord, brother.
Yeah.
Good evening, Anna.
Yes.
రీసెంట్ గా అది D3 లెవెల్స్ చెక్ చేసుకున్నామన్నా, నేను కూడా మా మమ్మీ కూడా. అది 11-13 ఉన్నాయి సార్ మాకు ఇద్దరికి. సో మీరు ఇచ్చిన డోస్, యాక్చువల్లీ మేము వీక్లీ వన్స్ వాడదామని డిసైడ్ అయ్యాము. మీరు ఈ మెసేజ్ బట్టి ఇప్పుడు మీరు చెప్పినట్టుగా ఫాలో అయిపోతామన్నా. పాప ఉంది, పాప కూడా ఇప్పుడు మీరు ఇచ్చారు కదా చార్ట్ చూసాను, అది కూడా దాన్ని బట్టి ఫాలో అవుతాను. కానీ మా మమ్మీకి ఇప్పుడు నేను D3 డైలీ ఒక మామూలుగా 7,000 ఆ క్యాప్సూల్ ఇస్తున్నానన్న విత్ విటమిన్ K2. దానివల్ల ఏమవుతుందంటే, యాక్చువల్లీ బీపీ ఉంది మమ్మీకి, బీపీ ప్లస్ షుగర్ ఉంది. బీపీ అన్నది యాక్చువల్లీ 40 mg వేసుకుంటారన్న. అది కూడా నార్మల్గా వచ్చేసింది అన్న. బీపీ డౌన్ అవుతుంది. 40 mg ఇంకా నేను తీసేసాను, కంప్లీట్గా ఆఫ్ చేశాను. ముందు 20 చేశాను, తర్వాత కంప్లీట్గా అది కూడా తీసేసాను అన్న. అంటే బీపీ కూడా దాని మీద ఎఫెక్ట్ ఉన్నట్టుంది అనిపించింది.
Absolutely. This is exactly why that is an excellent observation, Brother Pradeep. Brother Pradeep says his mother is suffering from blood pressure, and he noticed while she is on vitamin D supplementation, her blood pressure getting normalized, and so much so that he had to reduce her blood pressure medication to 20 milligrams from 40, and now she is not taking any blood pressure medication. That is exactly what we are hearing here also. Even in COVID patients, a month later, they come back and say, Doc, this is driving my blood pressure down, and I'm having to cut down on the blood pressure medication. So as I told you, all chronic conditions, vitamin D3 supplementation and normalization has extremely beneficial effects. Okay? And also with 13 and 12, brother, you need to aggressively correct it right now, because you cannot take any chance of contracting this, because you are in the very deficient group.
Okay.
Yes, Brother Madhu, please.
Yeah, Anna, similar to previous question, my auntie got positive yesterday. She is 64 years old and having BP.
Yes, I have addressed it. She should be on it right now. Okay, this moment. So give her 4 capsules straight away before she goes to bed tonight, and then from tomorrow onwards, start follow according to the schedule.
Sure, Anna. 4 capsule for 6,000 mg.
60, not 60,000. Yes.
Okay, thank you.
Not mg. It is IU. It is units.
Okay. Thank you.
Yeah, but Danny.
Hello.
Yes.
Yeah, praise God, brother. Actually, నాకు పాజిటివ్ వచ్చింది. 1 week అయిపోయింది. నేను జస్ట్ ఇప్పుడు హోమ్ క్వారంటైన్ లో ఉన్నాను. అండ్ మా మిస్సెస్ తను 7th month ప్రెగ్నెంట్. తనకు కూడా పాజిటివ్ వచ్చింది. ఇస్ అన్ఏబుల్ టు టేస్ట్ అండ్ స్మెల్లింగ్. అయితే ఇది ఎట్లా వాడొచ్చు అని డౌట్.
brother, you have to do it right now. Okay, it's just seventh day means you are probably on the 10th day or 11th day. That is when people are experiencing this severe breathing symptoms. So you cannot waste any more time. You start right now. And also even the pregnant women, this dose is not harmful at all, not to her, not to the baby. That is not a problem at all. Okay, because if this progresses any further, and if she goes into cytokine storm, that is far more dangerous to the baby and to the mother. So be careful. Do it right now.
Yeah, Jason, I think we have 5 more people. We go quickly because we are taking a long time from Dr. Bhanu. Otherwise, Brother Sudhin next.
Hello. Good evening. Good evening, brother.
Good evening.
Good evening.
Sure.
Very nice to hear all this, brother. Can I know the reason why the doctors are not suggesting, when so much help can be done with the D3, why the doctors are not suggesting? I mean, the pharmacies also. Definitely they could go up the sales, increase the sales. Why come? How come? Why are the not doctors refusing it to use it? And they're telling if we use it for chronically lung patients, diabetic patients, and everything, there can be other side effects which we can't be treated later.
Yeah.
So they are not at all suggesting it. Why
Yes,
couldn't? Can I know the reason?
You know what, the reason that you have to ask them, because in all the research that I have, in everything, everybody that we have treated are chronic lung patients and chronic diabetic patients. Everybody has responded extremely well. And even in India, people are responding extremely well. Every day I'm getting hundreds and hundreds of responses saying how beneficial this has been. You need to ask the doctors that, what side effects can we expect? Okay? So tell them, if they cannot be treated later, what are they talking about? I don't think they have any solid ground to stand on when they issue that recommendation. I think it is time for you to question them about their recommendations. Tell them why. Okay? Because some of them, I asked that question to them, and they said, because our textbooks say so. No, please, you need to be more more clear than that. Okay? You just cannot go by, you're a clinician. You cannot just go by once a week or a medical textbook or something says, because when your patient population is 70 to 80%, 80 to 90% deficient in this vital nutrient, and which plays an extremely important role in this disease progression, they need to come up. If they are advising you that this is going to cause this, and this, okay, tell them, ask them why and how. Okay, ask them how many people they have seen with vitamin D toxicity, and how many people they have tried to treat unsuccessfully for vitamin D toxicity. It will be 0.
I want to add a few lines to Dr. Bhanu. Really, we should ask these questions to doctors. I speak from my own experience that midnight, if I would not have taken 4 pills together at one time, I would have really died. I had a terrific storm, and I experienced, these people want a law, they want a paper, they want a proven kind of lab test. Some of them are asking, did you check your vitamin D levels? There is no time to go and check and take, and you can't believe how aggressive they are coming. One doctor said, I will put you in jail because you're spreading rumors without any proper proof. No, this is not the time to go for proof. It is a time to live. This is the time to live. I survived, and I want to tell this truth to my friends. And that's the reason we arranged this meeting. As Dr. Bhanu says, nothing happened to me. I took heavy dose for 5 days. Still I'm taking 2 more days. Nothing happened to me, neither to my wife. So we have survived, and this has absolutely helped. Only this is a vitamin. There is no problem. I think we'll go to Sudhir. You have any question?
Yes, brother. Thank you. Brother, praise the Lord. I have a chronic breathing problem. So I am allergic to artificial smells like mosquito coil or incense stick or like air freshener or perfume, deodorant, all these things. So when I breathe these smells for around like 5 seconds, I feel like, lungs are really squeezed like balloons and I can't breathe. But with any natural smell, I'm okay, like flowers or milk heating smell. Such kinds of smells, no problem at all. So this is a chronic situation I'm going through past 1-2 years. So my concern is, first of all, I have to treat it. Now, in this situation, am I more prone to COVID attack? Is what I'm thinking now.
Okay, brother. See, there is no way of saying. See, the thing is, it is entirely possible. What that tells me is when you exposed to those chemicals, your immune system is reacting in such a way, and it is generating this inflammatory compounds or cytokines, and which you can sense by you're not able to breathe freely, and so that is as kind of a cytokine reaction. So, and also this COVID-19 is the climactic event is a cytokine storm. So yes, it is possible that you're more prone to this, and you need to check your vitamin D levels, and you need to bring your vitamin D levels up. And my suspicion is when you bring your vitamin D levels up, I think your reaction to these artificial smells also will subside. I think that's what would happen, and that's what we have noticed in several patients here also.
Yeah, Brother Victor. Brother Bhanu, is it okay? You have some more minutes?
About
we can
10 more
go.
minutes.
Yeah, we can take later.
Brother, praise the Lord, brother. Yeah, this is Victor, brother. My question is a little bit longer. So you said, brother, while you are this vitamin D3 is a cholecalciferol, while you in the transportation, right from the absorption, transportation, conversion, active form, all these things process. So you're taking vitamin D3, it has to convert into the calcitriol, right, brother? But brother, I am into the marketing, brother, vitamin D3. What we find, brother, for the metabolism of the vitamin D3 also, magnesium is required. So that's why it has been launched, brother. But my question is, if you are taking, if it's any malnutrition, then how is the excretion and what is the toxicity, brother? Vitamin D3.
Okay, wonderful. That is an excellent question. So when you take high dose vitamin D, the magnesium deficiency is possible. It is not only possible, it is probable. You need to get good levels of magnesium. Yeah, previously, in the last days when we were not using organophosphates and organophosphonates, our food was we had good amounts of magnesium in our food. It is not there anymore. Okay? So we need to pay attention to that aspect as well. So the thing is, we can cover a whole lot of issues with this vitamin D and its conversion and transportation, excretion, and all those things. But the concern now is the goal now is to fix the deficiency as quickly as possible because of the community spread situation. Yes, the toxicity, if the toxicity does occur, that results in, the first thing that you see is the calcium levels going up in the blood.
Okay.
The hypercalcemia. Okay. And also, please get magnesium and take it as soon as possible. Supplement with 1 to 2 grams of magnesium daily. 1 to 2 grams of magnesium daily. I think that is going to improve the outcomes with vitamin D. And also, not only magnesium, manganese is important. Chromium is important. All these trace minerals are important, which our food is totally devoid of. I think we need to keep this discussion going in the days to come. Okay, even after this crisis, we need to keep this discussion going. So we can, because it is our health. Okay? And we cannot just completely blindly entrust it to anyone. I think this is a team effort. We are the major part of this team. Thank you so much for bringing up that question. Thank you.
So let's conclude this question and answer discussion with Brother Francis' final answer question. Maybe we'll continue as Dr. Bhanu says. We'll find his time, and maybe phase 2 we'll connect the other time. Maybe if you have any other questions, you post me. I will take those questions to him. He will answer me. But today, let him go by answering to his question. But Francis, one of our students in the Coach Institute. Francis, can you explain your question?
doctor.
Yes. Your audio is breaking up, brother.
Praise God for the gifts God has given to you.
Thank you.
My granddaughter, 5 years old, she has granddaughter 5 years old. She has so morning she feels and six off, and probably because of what I call it, children they get. Suddenly, I didn't get the word. I'm sorry. I'll get back to you otherwise.
Yeah, could you can send that question to Dr. Potana, and he
She
can send it
gets
to me.
fits. She gets fits in the morning. She got it at 3 years old, and now she's 5 years old. In the March, she got fits, and doctor gave some medicine. We give it. She'll become all right after. Is
So
it good for her
epilepsy.
to give this D3?
Okay.
The epilepsy, exactly.
Yeah, the epilepsy. So
I can't call it exactly. Suddenly she gets fits.
Okay.
Doctor gives it. She was hospitalized 1 week earlier, 2 years back. Now she's not getting it, but in the March in the morning, suddenly she got it. She gets it, and we give her medicine. She'll become all right afterwards. Our eyes, our eyelids go up.
Yes, brother. Okay, okay. What we can do is this, brother. Okay, so why don't you? Did you get her checked for vitamin D level? See, in most of epilepsy and seizure patients, their vitamin D levels are extremely low. So you can send the details to Dr. Potana, and we can take a look at it offline. I will send. We can even talk over the phone. Okay?
Yes.
Thank you, doctor. Nice. God bless you.
Yeah. So, friends, we need to appreciate Dr. Bhanu for his time. I know that we took snatched extra time from him. Dr. Bhanu, we are so grateful to you for taking time and helping us to understand. Let's all give a round of claps to him. Let's appreciate him.
Thank you. Thank you.
So we have no words to express the way that you have explained everything, and our hearts are filled with gratitude to you for the way that you blessed us with this almost 1.5 hours you took time. And our friends are in the queue now to ask questions, but you can post your questions to me. I have given my number. If there is any emergency, I will connect you with the doctor. Maybe we can see, I'll find a time from him, and we can conduct a phase 2 level where we can take it further, and he will explain more, and you can ask questions. Thank you very much, doctor. We are so grateful to you, and we allow you to continue your work in the shop.
You're welcome. Thank you so much, Dr. Potana. Thank you for having me here.
Yeah. Okay, friends, we are so grateful to you for sparing time. I think there are so many hundreds outside waiting, but this room allowed only 100 people. That's why after reaching 100 people, it's not allowing people to get in. Maybe I need to buy some other thing to extend the permission to get other people to host. So we see the next phase 2, how to go about it. I have given my number. If you have any questions, you can be in touch. We really
brother, please give me your number, brother.
I have posted in this. Otherwise, you can write down 83095 83095 11427. 830.
Repeat, sir. Repeat.
83095 11427. It's there in the chat.
Okay, thank you.
Yeah. Okay, let's take leave today, and we come back again. I request my students, please come back on Monday. We will have a class, and AJ Smile, Brother Smiles is presenting the paper, and we resume our classes from Monday. Thank you very much. God bless you, and have a good rest. Bye-bye.